Okay, I suppose this is something that we're hoping to study, do a qualitative study with Professor McFarlane later on in the year, is to why do some patients comply with advice and medications more than others. Why are some more concordant? And you even see it within the same patient that some crisis may happen in their life and they go into crisis mode, and part of crisis mode would be comfort eating, and so you see that their control will deteriorate. And the first thing that I would always do, and even before starting medication, is bring the patient in and ask them what's going on and why has their condition deteriorated. And in some cases they'll say, look, I've no idea, I'm doing everything you've told me, and I'd know them well enough to be able to say, fine, okay, well look, in that case there is definitely a deterioration in your condition and we need to kind of move on, and then you look at medication. But in many cases they'll say, look, something awful happened, something happened to one of my children, or my spouse was ill or something, and look, I ate all the wrong food, I did all the wrong things, and and they're there and they're apologising because they feel they left me down. And so we then have the little chat and they go out and they're determined. And I had such a fellow gentleman in yesterday actually, and he said, you watch me, he said, and I will be back in 3 months and I guarantee you those sugars will be down. He said, thank you for trusting me, I guarantee you they'll be down. So we shook hands on it and he's going off and he's going to see to himself.
Excellent. Excellent.